Good afternoon, I'm your doctor, and I will be conducting your cranial nerve examination today. Yeah, with a head injury, sometimes it disrupts the communication between the brain and the motor and sensory abilities. So I will be just navigating whether or not this injury on your head, this impact, has caused any early signs of trauma and neurological damage. I will be providing you with a series of simple and basic, quite relaxing and painless tests, and just spending some time looking at the wound and your eyes, your ears, making sure everything is well there, as well as your senses like smell. And I will be just touching various parts of your face, making sure everything is running smoothly. Fantastic. So I'm going to go ahead and just start off by confirming your full name, please. If I can also have your middle name, if it does appear on your ID, just to notify me about that as well. Okay, very good. And may I please have your date of birth? Okay, thank you. And may I please have your current address? Okay. And your phone number? Okay. Alright, very good. Okay. And if you can go ahead and just explain to me how this injury occurred. Okay. Okay. All right. I noticed that you do have a bandage that has been placed over the wound. Can you just let me know if that was tended to by a paramedic or a nurse? Okay, so that was self-applied. Okay, that's no problem. I just want to take a look at that and make sure that we just sanitize that wound. I'll also take a quick look, to make sure that the wound hasn't caused any swelling around the back of your head. Okay, great. And that's good. Okay, so I will go ahead and take a look at that. I will start off by just putting on some gloves. Yeah, I just want to make sure that we keep everything nice and sanitary. Alright, so just putting the gloves on. Okay. Alright, very good. So I'm going to go ahead and remove that bandage. I am not going to tear it off. I don't want to cause any bleeding or any further damage under there. And once I get this glove on, I will just go ahead and grab my tweezers here, just like so. And I'm just going to go ahead and check that wound there. So I'm going to come in here and just take a quick look over here. Okay, so I see that it's just on the side of your temple area. Okay, and how does that feel? Does that feel like a heavy pressure or any severe tension when I touch this wound? Just a little bit sore. That's totally fine. Okay. All right. So I'm going to go ahead and remove the bandage, just slowly. Okay. Okay. And just on this side. Just like that. Okay. Okay. And I will discard that. Alright, let's take a look here. Alright. Okay. Okay, and so this is the area of impact. Okay. I don't see any further swelling here. Okay. Yeah, that looks okay. It's not so bad. I'm sure it's feeling sore, but it definitely could have been a lot worse. Okay. So I'm going to go ahead and disinfect the wound with this cotton pad. And I'm just going to use this to disinfect. Very good. And we'll go with the tweezers here. And I will just apply that there. How's that? It's okay? Okay. Very good. I'm just going to hold your head steady there. And I'm just going to move your hair on the side here. Just wipe down that wound, make sure that we get all of that out. Very good, very good. Okay. Alright. Good. Perfect. So now I'm going to go ahead and apply some ointment. I'm going to apply some ointment to the wound area. Okay, so I'm going to go ahead and apply that right there. Just rub it in a little bit. Okay, just like that. Very good. And a little more here. And this should also help the swelling. Here. Okay, good. Alright, now that your wound has been thoroughly cleaned and the ointment has been applied, I'm going to go ahead and apply a small bandage on the wounded area. Go ahead and remove this bandage. And I'll go ahead and just place this on your wounded area. Okay. How's that? Good? Good. Very good. Alright. I'm happy that we have cleaned that out and everything is looking quite nice. I'm going to go ahead and begin your cranial nerve examination, and I will start off just by listening to your heart. I'll be listening to your lungs as well. Right? Okay, good. Let me make sure it's nice and warm for you. Okay. And you can just relax your shoulders. Very good. Okay. Very good. Alright, and I'm also going to listen to your lungs. So if you can go ahead and take a deep breath in. Okay, and out. Very good. And again, in. Okay, and out. Perfect, okay. And now I'm going to go ahead and listen to your lungs from your back. Okay, so I'm just going to come around. Alright, and you can go ahead and breathe in. Good, and you can breathe out. In and out. Okay, very good. And I'm going to come in around the other side here, just over here. Very good. And you can go ahead and breathe in and out. In and out. Alright, very good. Alright, everything is sounding great. So far, so good. I'm going to go ahead now. I'm going to go ahead and check your pupils, your optic nerve. And I'm just going to see the direct and indirect responses that your pupil makes when I shine light by it and on it. So I have this pen here. It's a pen light. I got this during my undergrad. It also is very helpful when working with children because this light shines from far away, the Superman S. So it is a very helpful tool, both with checking exams such as this and also calming down patients. Alright, so I'm going to go ahead and use this dim light just to look at your pupils. So you can keep them open, just relax. I'm going to go ahead and hold your face here, and I'm going to be shining the light. Okay, here we go. Very good. And here. Alright. Very good. And here. Okay. And here. Okay. And here. Perfect. Okay. I'm just going to ask you to keep your head still, and with your eyes alone, just follow the pen. Very good. Very good. Follow the pen. Very good. All right. Good. Just follow. Perfect. All right. So now I am going to go ahead and ask you to just cover one of your eyes. Okay, very good. Just let me know when you see my hand, okay? Okay, here we are. Good. And you can just point. Good. Very good. And you can release that hand and cover the other one. And when you see my finger, good. Very good. Very good. Okay, you can remove that. Alright, everything is looking fantastic so far. Okay, I'm going to go ahead and just look into your throat area. And I'm going to just ask you to release your jaw. Thank you. And here we are. Okay. Very good. I'm just going to tickle the back of your throat a little bit. Okay. Very good. Again. Great. Okay. Everything is good. And I'm going to close your jaw. And I want you to try and open it, okay? Good. If you can just clench. Alright, very good. And if you can also just frown for me. Okay, very good. And also if you can puff out your cheeks. And release. Okay, can you do that again for me? Puff out your cheeks. And release. Alright, and smile. Lovely smile. Okay, very good. And release. And can you raise your eyebrows up for me? And release. And ask you to do that again. And release. And can you frown? Alright, and release. Alright. Everything is looking fantastic. Yep, you are passing with flying colors. I don't have any concerns as far as neurological damage, but I am going to go ahead and continue with the test and just do a series of different scents. I'll have you identify them. So if you don't mind just closing your eyes, I'm going to go ahead and let you know when the scent is available for you to see. And I'm placing it under your nose. Peppermint, very good. Alright. And my second one. Okay. And just coming under here, on your nose. Orange. Very good. Alright. And lastly, just under your nose. Lavender. Very good. Alright, everything is good. Very well. Okay, and I'm just going to go ahead and do a quick ear test on you. So just let me know, with your eyes closed, what side you hear the sound, either the right or the left. Okay. Very good. Very good. Very good. Okay. And very good. And now I'm going to go ahead and list a series of numbers, and I will be whispering them in your right and left ear. And you can just repeat the numbers to me, okay? Great. 41. Good. 22. 17. 61. Okay. 11. 0. Very good. And if those are the lottery numbers, then I get half. I'm going to go ahead and just do a series of tapping in different areas of the face on different muscles. Alright, and we're just basically seeing if the sensation is the same, that there's symmetry on both sides. So I'm going to go ahead and tap with this blunt object, just a blunt object here, and lightly tap. Okay, you can feel that? Alright, just let me know if there's any numbness or any sensation that's unfamiliar to you, okay? Any pain or discomfort. Alright, here we are. And how's that? Good? Okay. And just here on your chin. Very good. And on your forehead. Alright. And I'm going to go ahead and just tap different parts on the side. Okay. I'm just going to hold your head steady. Very good. Okay, I'm going to do the same exact pattern on the other side. And just like so. Can you feel that? Same thing? Okay, very good. Okay. I'm going to go ahead and press on your chin now. And that's okay. And I'm going to go a little bit harder here on your forehead. Just around the wound area. Let me know if you feel pressure anywhere in your head, okay? You're fine? Alright. Very good. You might experience some jaw pain just from the impact of your fall, and that is quite normal. You're welcome to both ice and place heat on it. I would go forward and back on that. Yeah, compressing with a heating pad or taking a hot shower is very helpful. If you are experiencing any headaches, I would take an Advil or an aspirin. If anything is abnormally painful, like a migraine or pressure in the head and temple area, please do contact us immediately or go into the closest emergency. But looking at everything, and so far with the tests, I have no concerns. I think everything is fine, and that this is just a flesh wound, and that you are completely fine neurologically as well. Alright, so I'm just going to go ahead and just massage your face a little bit here. Just let me know if you feel any tingling or anything that is unfamiliar, any pressure. Okay, very good. I'm going to do the same thing now with tissue paper. This is a light touch, so I will go ahead and do the same series of movements and patterns that I did with the blunt object. Okay. So here we are. Alright. And can you feel that sensation with the tissue paper? Okay, very good. I'm going to go around your face here and just go like so with the tissue. And you can feel that sensation. Very good. And on the other side here, just over there. Can you feel that? Okay, very good. And on your forehead here. And how's that? okay? I'm going to go even lighter now. Just a very light touch. Just a light touch. And let me know if you can still feel this. Alright, tickles. And on the side. Good. And here on your chin. And on your forehead. You can feel everything? Alright, good. So there's no numbness and everything is looking great. Alright, I am very pleased with our session today. I'm just going to go ahead and make some notes. And you can bring this to the front desk with you. I will give you a copy for your records. And the receptionist up front would be happy to give you a follow-up schedule for next week, and you can pick whatever time slot works for you. Alright, perfect. Yeah, I am not concerned. Just make sure that you take it easy and don't do too much activity, just with a head wound. Though things are fine now, you don't want to overdo it and cause any damage at all. Good. Yeah. Alright, very good. Yep, your heart and lungs are healthy. Okay. And just make sure that you are changing the bandage every so often and making sure that the wound stays clean. Okay. Alright. Just let us know, again, if there's any issues that come up later on during the week. Just with vision, memory, smell, touch, feel. If anything seems abnormal, you can simply call us at the office and we'll have you come in right away. Or, of course, if it's an emergency, then just go to your nearest hospital. But I'm not concerned about any of that. I think it's just a flesh wound, and that a little rest will go a long way. Okay. And if you find that you're just not getting enough rest, or that the wound is bothering you too much, then I will write a prescription here for you, okay? Great. All right. Well, it was a pleasure seeing you today, and I will make sure to go over everything with you next week during our next session and find out if there's anything further that we need to do. Bye now.